there any questions on any of those? Do you feel comfortable performing these tests? So anterior drawer. The book shows you grabbing the calcaneus here, stabilizing the lower leg, and then moving the ankle forward. I perform it by grabbing the talus and moving forward here. Again, it should be at about 20 degrees dorsiflexion, so there's more movement in there, so you don't get a false negative.
Would you take off if we were to do either or?
What's that?
Like grab the
talus or?
No, you can do either one. I mean, there's even one where you're prone and you pull down this way. So,
that could hurt, yeah.
Talar tilts, again, you can do it in two different ways. Again, at 20 degrees of plantar flexion, you tilt it into inversion, and that's testing the anterior talar fib, ATF ligament. You keep it at neutral, and do the same thing. You're testing the calcaneal fib ligament, CF. You can go the other way, which is the inversion stress test, and that'll test the deltoid ligament. And then your external rotation test. Again, you want it jammed as much as you can into the lower leg, and then you externally rotate it. If they have pain on the outside or on the inside of the ankle, the medial malleolus, it's deltoid. If it's kind of that high ankle up on the tib fib, the anterior tib fib, it's more of that, this word says tendinosis or high ankle sprain. Okay. Questions on any of those? Did you all get the list of skills could be tested on? Was anybody able to download the exam? Yes, no problems? Okay, so make sure you have that downloaded by Thursday. Joint play. Alright, so talar crural joint, again you want it about 20 degrees of plantar flexion. And if you bring it, that's a PA glide, if you bring the foot up, very similar to the anterior drawer, and you're checking for stiffness or tightness in that joint, you can change directions and do a AP or a posterior glide of that joint. Distal talar fib, TF, you can do, again, you stabilize the tibia, push on the fibula, either posterior or grab it and bring it anterior. And then the last one, subtalar, you stabilize the talus and then either push the calcaneus lateral, this is medially, or laterally. You can do it either sideline or you can have them, again, off the table and supine. Just bring it this way and this way. Checking again for stiffness. This movement here, there's very little movement in that joint. So you may not feel very much. There's a big difference from doing that, talar tilt versus this calcaneal, this subtalar joint play. Okay. Do you want to practice that, or do you want to move on to the other special tests? Other special tests?
Yeah, which
We can come back to this. Again, neurological testing and vascular testing, you want to perform as needed. Again, what's one reason to perform a vascular test? If you suspect a when would you want to do a vascular test?
You expect like a blood clot? Or
What's that?
like a blood clot? Or
Blood clot, you probably wouldn't get that on because this is the pulse and capillary refills is more arterial. Blood clot is usually in the veins. if there's a fracture, whether it's open or closed, or what's the other thing? Dislocation. Remember that? There's a dislocation. We want to make sure the blood supply is still there. Good. Again, neurological testing, we can test the Achilles reflex there. We can test the myotomes for the lower leg. So L4, L5, S1. Remember those? Hopefully. All right, special tests. So we went over one special test for the high ankle sprain, your external rotation. Here's some other ones. The cotton test, which is not done very often. I actually forgot what that is. I think that's the lateral glide. So what you do, you're pushing the talus laterally against that fibula and opening up that spot here. Okay. Make sense? That's only one direction, yes. So basically you have them, you can do it either in supine or you can do it sideline, and you're pushing laterally on that talus to open up that space. Squeeze test is very simple. You're just squeezing up here on the tib fib, and that opens up the distal tib fib space. Squeeze test may also indicate a fibular stress fracture because you are applying pressure here. So that will irritate somewhere up here. All right. Modified audible ankle rules. Anybody heard of this? No. These are basically some rules. If your patient has any one of these symptoms, you should refer them to have X-rays because there's a high likelihood that there will be a fracture somewhere in the lower leg. So if they're unable to walk 4 steps at the time of initial injury or when you're examining them, let's send them for X-rays. Okay. TP means tender to palpation. So if it's tender over the posterior edge of the lateral malleolus, send them for X-rays. Medial malleolus, send them for X-rays. Navicular, again, send them for X-rays. Or base of the 5th metatarsal. So for X-rays. Any of these symptoms, you really want to X-ray to rule out fractures. It saves a lot of time and a lot of headaches. So you can really get to your treatment better or put them in a cast and immobilize them. So extended rupture. What does the Achilles tendon do? What's its role?
Is that like spring?
What's that?
I guess it's like a spring, or whenever like we run or like.
It's the tendon for your plantar flexors. So the plantar flexes the ankle. Up on your stomach. This way, yeah. Feet off the. Very simple test. You squeeze the calf, and you should see the foot move into plantar flexion. Everybody see that? Very simple. If the Achilles tendon was torn, you wouldn't have as much plantar flexion there. Pretty good test, very easy. You can stay there. Bump test, very simple. You're just bumping the heel. You can do this throughout the body. Again, it produces vibrations up the lower leg, kind of irritates that stress fracture. Very similar to that squeeze test that we did. And I'll show you that when we flip over. And then DVT. Everybody know what a DVT is? You had it earlier. blood
Oh,
clot.
deep vein thrombosis.
Yes, blood clot. Very serious thing. What you do here is you just forcibly dorsiflex the foot, and you should feel if they have a pain in the calf. That may indicate a DVT. The only problem with that is that test isn't very accurate. It's not very valid. So they may have several other things that can cause deep pain in the calf that may not be a DVT. So you have to look at other symptoms, such as headaches. You may be able to palpate a lump in their calf, things of that nature. Coldness. Things. So again, this by itself is not a very good test, but it's still being used, so you should really look at it. Flip over. Let me show you the squeeze test real quick. We're going to use for both high ankle sprain and stress fractures. You just squeeze the lower leg. Okay. And then the other test is that lateral, the cotton test, that lateral shear. Where my thumbs are? Yeah, the finger is on this side.
Oh, okay. I guess. Okay.
We're pushing it that way. So if it was not intact, or if it was a tear, then you would have pain right in this top aspect. That's all we have for stress today. Okay, so go ahead and practice these tests. And we'll come together, answer any questions, and I'll do anybody have foot pain currently?
Anissa?
You don't mind if I record you?
That's fine.
You already said it.
What's it?
I said you already said it. It's on.
So I'll do a full evaluation, and then we'll have a review for either the written exam or the practical exam.
I'm signing off.